welcome to yet another amazing episode on mental health. And I am your host, Sylvia Korea. Today, we still have the panel from last week, but we're still going to give them an opportunity to introduce themselves. Karibuni sana wageni wangu.
Thank you, Sylvia. Hi, everyone. My name is Nancy Wanjiru Kafiro. I'm a psychologist. I work with PCEA Psychology Consultants.
I'm Grace Kashanja, psychologist at Chiromo Mental Health Hospital. Happy to be here.
I'm Mark Nyandri. I'm a student pursuing a degree in information sciences in university. I'm a sports journalist and also a YouTuber. Thank you.
All right. Thank you very much for being here. And I'm happy to host you again. So the first question we have today is, what is depression? Nancy, can you take us through that? But before you do, Mark, let's get a general perspective.
From a layman's point of view, I think that depression is the inability to anticipate pleasure, the inability to think critically, the inability to, obviously do whatever you do on a day-to-day activity or on a day-to-day basis because of stress-related stuff like, let's say, low self-esteem and stuff. Yeah, so I think that's my general opinion about depression.
Grace, please.
Very similar to what Mark has just said. Depression is what is included in a group of disorders that we refer to as mood disorders, and it's mainly characterized by prolonged periods of low moods, reduced interest in activities, either feeling numb or finding yourself crying a lot, having changes in appetite, changes in your sleep pattern, changes in the relation that you have with the environment around, so you find yourself being more withdrawn than usual, not feeling like interacting, things, extreme fatigue in some cases, and that a combination of those symptoms lasting no less than 2 weeks. Yeah, that is what we refer to as depression.
All right, Nancy, let's hear from you.
It's a mood disorder. There are people who learn how to mask depression. So someone may be in a low mood, but because they are required to be in the presence of people, they then will come out looking happy, but they are still undergoing depression. So untreated depression leads to other ailments. And for you to be diagnosed with depression, you need to have these low moods for 2 weeks. So 10 to 14 days. Then we would say that you have undergone depression or you're going through depression. Yeah.
All right. So you have mentioned all that. And now I am very interested to know on what are the signs and symptoms of somebody suffering from depression. Kindly, Mark.
I think one of the signs of depression is isolation. You may notice someone suddenly tending not to turn up to events, to turn up to workplaces, to turn up to class. And I think one symptom of depression is, in my opinion, I think you may find yourself suddenly not in the mood to do what you enjoy doing. Maybe you don't want to enjoy pleasure through watching movies after a hard day at work, after a tough day in school or class. Yeah. And in my opinion, those are some of the most common signs of depression.
All right. Thank you very much, Mark. So, Grace, kindly feel free to expound more. And as you answer that question, also answer for me the different stages and types of depression.
Okay. I think I'll just throw in a couple more symptoms of depression. This can either be observed or felt by the person. So, in addition to the reduced interest in activities and the social isolation, we also have changes in sleep, such that someone either sleeps too much or too little. The appetite is too much or too little. And then we also have changes in terms of fatigue. You can find fatigued while not feeling, just feeling fatigued while you've not necessarily done much. So you'll wake up and you'll feel tired. You probably spend the whole day chilling, but you're still feeling tired. There's the feeling hopeless, feeling worthless, and the most significant, which often leads to not only admission but also death of people who've experienced depression, are feeling suicidal and actually going ahead and committing suicide. With reference to the stages or the types of depression that exist, one of the most important things that we all need to take note of is that depression is one of those illnesses that is gradual in terms of its onset. You don't just wake up one morning and you find that you're depressed. It starts off as a process, and you'll notice that it starts off slowly. You have more and more common experiences of low moods. Kidogo kidogo, you sleep, your appetite is affected. Kidogo kidogo, people are calling you to hang out with them, and you're coming up. You're reaching out to your basket of excuses, looking for what do I really want to go? Or you'll actually plan to go, but then when the day itself arrives, you don't feel like going. So it's a gradual process. And then in terms of what are the different causes of depression, or whether there are different types of depression, indeed there are. We have what can be called as depression in itself, which is a brain disorder that can be as a result of maybe one's genetics, maybe previous experiences of stressors and things like that. And then there's depression that can occur post-birth, which is what we often refer to as postpartum depression, and a lot of women can relate to these. This occurs about within 2 months after the birth of a child, and can be triggered by various things. We have depression which is often happens, especially in the cold season, more experienced in the northern and southern hemispheres because of the period of winter. That can be a trigger for depression in those people. And one of the most significant ones that we're seeing an increase in currently is depression due to other medical conditions. And one of these being once someone is diagnosed with a chronic disease, such as cancer or diabetes or hypertension or HIV/AIDS for some time back, even currently, depression can occur as a result of these medical conditions. So that's just but a few of the types of depression that exist.
All right. So thank you very much, Grace. And now next into Nancy. Which gender is more prone to depression?
When we are talking about the youth, we are talking of people who are in their teenage years on to early 20s into 30s. And at this point, they are undergoing a lot of body changes. The brain is also growing and expanding. So they may have hormonal imbalance. And because women are cyclic, meaning that every month you go through a certain cycle, your hormones also go through that cycle. So the gender that has a high depression rate is the female gender. Men also have a depression rate, but compared to women, would say it's 2 to 1, 2 female for every male who is undergoing depression. And also, when someone conceives, they undergo a lot of hormonal changes, so they may be prone to depression. There are other factors, and that this also still applies to women, because you may have to use birth control, and birth control can also lead you to developing hormonal imbalances, which may lead you to getting depressed, even without yourself willingly putting yourself in that situation. So generally, women are the ones who are more prone.
All right.
Yeah.
Okay. So you have said hormonal imbalance mostly in women. All right. Okay. Next, Mark. Could you kindly tell me the various causes of depression in youth?
In my opinion, I think one of the reasons youths suffer from depression is because of esteem issues. And these esteem issues are caused because of various reasons. Maybe as a child you suffered from obesity. Maybe you had academic issues that caused problems between you, your peers, and your teachers and parents. Maybe even you suffered from peer pressure as a youngster, and one thing led to another, and it led to unprecedented events like having to take part in drug and substance abuse. So I think those are some of the most common signs of reasons for depression among the youth.
All right, Nancy, I will also ask you to kindly add into now from the general perspective,
Okay.
other just from the youth. What are the other causes? Yeah.
So he's talked about the social support for someone. If you don't have a good social support, you may go into depression. He's also talked about drugs and substance abuse, because we know some drugs are stimulants, some are, they will inhibit your mood. So it will affect your hormones and your body balance and even the chemical or communication of your neurons in the brain. He's talked about stress, that is maybe in school or at work, demands. Then he has talked of unlearned helplessness, which is a thing. When you talk about, what did you say? When you talk about bullying, like if you've undergone bullying or you're not accepted by a certain group, you may then develop a coping mechanism. Maybe you become introverted, or you learn a helplessness nature. And when you become helpless or you learn helplessness, you start perceiving things negatively. And when you perceive things negatively, ultimately, your whole world of vision of everything that you're trying to do becomes unbearable or something that you cannot be able to achieve, generally leading into depression. There are early marriages, we could say, work pressure, relationship issues. Like if you're trying to get someone to date and they keep turning you down, you can end up hating yourself or perceiving yourself differently. There are other issues like if you have undergone a traumatic incident, say you went to a party and maybe they did things that are not, they don't conform to your values. Then you get PTSD that can lead you to developing depression. Yeah.
And I think maybe you can add one point. Your background, your upbringing also contributes very greatly to your mental health, and it can lead very easily into depression. Okay, next, this is for you, Grace. Could you kindly tell me about medication? Does it contribute to mental disorder, depression? Does it contribute to this issue?
I'd say yes, though not all medication. There are medications that can lead to depressive symptoms, and not all medications. So in case you're taking any medication and you find that it is bringing up depressive symptoms within you, it is always very important to communicate with your doctor so that you can have that discussion. As earlier mentioned by Nancy, she also mentioned that a lot of the hormonal contraceptives that are being used by women currently also contribute to depressive symptoms and the experience of depression as a whole. Yeah.
All right, so now I have heard us mention so much about women. Does that mean that we are like the most extreme vulnerable species, or what is the problem? Why are women so prone to getting into depression? Honestly, just answer me in all honesty.
It's a mood. We say depression is a mood disorder, so affecting your moods. And generally, women reason or act on emotion, on impulse. Okay, so when you're then taking a drug, or you're in situations that will affect your hormonal imbalance or your brain communication, then you're more prone to these situations. It's the way nature has designed things to be, and that's what makes women more beautiful or attractive, because we have all these signs and we yeah.
Let me add on to that. It is also because as women, we are more help seeking as compared to men. If a woman is going through a situation, she's going to talk about it more. So it's more common for you to hear a woman say that I'm going through this difficult time. I've been feeling like this and like this. But on the flip side, currently, we're finding more men talking about what they're feeling and what they're going through. So over the past couple of years, we've had reports of increase in depression among men. And that's something that we're really talking about. And it's one of the best things about a conversation like this. Because once we start a conversation like this among the youth, when these young men, these young women who are listening to us go out there, they will be more open to say, hey, this and this has been going on. I think I need help. Or they'll listen to conversation like this and they'll be like, hey, I'll call Nancy or I'll call Grace. Maybe I'm going through depression. So starting a conversation like this, especially among men, And not just in forums like this, even in our churches, in our youth, it's very key. Because, as women, we talk. Men, they don't talk. We've grown up to know that if a man cries or shows emotion, it's a sign of weakness. Please, it's not. So don't do that. Talk. In your small chamas, in your small men's groups. If you don't talk, then you will find more cases of suicidality, more cases of homicidality, which is a problem. And that's something we do not want. So conversations like these do normalize depression, do normalize that times get tough, so that sisi si wanawake tu tunaongea.
Mark inaonekana uko na kitu ya kusema, tafadhali.
Okay. Yes, there's that myth where as men, it's a sign of weakness when we don't show our emotions, when we don't talk to people. But I think we live in a world where change is inevitable. And because change is inevitable, what doesn't kill you makes you stronger. And by this, I mean, by talking to someone to help, a problem shared is a problem half solved, you see. So I strongly concur with Grace by saying that as men, we need to step up, and when we have issues, we communicate with our peers, with our elders, so that one thing may not lead to another, and we end up in an unavoidable situation like that. Yes.
Nancy, do you have something you want to add?
I feel they've covered everything.
Okay.
Yeah.
Sawa. All right. Nancy, my next question goes to you. What are the other ways of dealing with depression other than drugs? Or medication, medication.
So when we know that depression is a mood disorder, then you look at yourself as a whole. You have to decide what is it that makes you happy, because depression makes you flip on the other side where you're feeling sad and low. So what makes you happy? So self-care is one very important key aspect, where you get to do the things that you like doing. It is important to create a routine, change it a bit, keep tweaking it a bit to create challenge for yourself every other time, because human beings are motivated by the achievement of a challenge, or knowing that you can actually achieve something. The other thing is you can also go out for exercise. So you can do this by yourself, or you can get an exercise buddy. That will help to build happy hormones within your body, help therefore reducing the stress capacity or the stress stage of your brain. You can also keep in touch with people. You can do this by the social media communications that are there. You can also volunteer. Human beings are prone to wanting to help another. So even when you're feeling depressed, ask yourself, what is it that I can do that can be of help to somebody else? We have had cases of people saying, I was suicidal, but because I met someone in a worse situation than I am, and I was able to help them, then that made me pull back from my suicidal thought. So always ask yourself, what is it that you can volunteer for? Do it. Help someone. Plug yourself into all these self-help groups. Educate yourself. Keep reading and researching about the feelings and the symptoms that you're undergoing and where you can be able to get help. Then there is talk therapy, where you go seek a psychologist who would help you then analyze your coping skills, your understanding, your perception of the world, so that you can be able to overcome the challenges and even go back to your childhood, because the upbringing of someone has a thing to do with what you are. So when you're able to go to a psychologist, you're able to understand where you come from, how you perceive things, and what has contributed to you getting to that point. So those are the points I can think about.
All right. Now you have mentioned all these things, but let's assume that an individual has been stuck in the house for 3 months, depressed, and they can actually feel that everything about themselves has changed. How does such a person get to the point where they can leave the comfort of their house and now, because you'll find maybe this person has switched off their phone. I don't know, people start assuming you're busy, So how does an individual get to that point where they're like, okay, nime hibernate for 3 months.
Yeah.
How do I get out? I have accepted, or I have started, or I have identified that there could be something wrong with me. How do I leave my house?
accepting that you're actually going through a process. You have to have a self-acceptance and not worry about what the general society is going to say about you. Having the willpower to make that move, or to even approach someone who can be able to help you or understands you. And when you see someone is isolated, or you're not seeing your friend for some time, try and reach out. If they're not picking up their phone, go visit them. If then you can't be able to visit them, ask someone close to them. Know a family member. It is important to keep tabs with everybody. And the person who is depressed and has been home for like 3 months, then you need to change your perception of things. And that is where you challenge your negative beliefs, because there is that learned helplessness probably you have, and it can drive you to actually thinking of ending your life because there's nothing important or exciting enough for you. But if you can be able to push yourself to go out, see what you can volunteer in, who you can help, then that can take away the depressive symptoms.
All right, Sawa. Thank you very much, Grace. Nancy, sorry. Next, we're going to have Grace. Kindly tell me, are drugs necessary? And at what point does one have to start taking drugs?
Okay. An important point to note is that depression is one of those illnesses that even without treatment, it dissipates by itself. Meaning that someone can be going through a depressive phase, but it wanes off on its own without necessarily seeing a therapist or taking medication necessarily. So this is a very important thing to note, that not everyone is going to need to take medication to manage depression. But at the same time, it brings down, you remember last time when we talked about mental health, we talked about what is indicative of mental health, and we talked about changes in behavior, changes in functionality such that you're not able to function, being a danger to yourself and to others. When depression gets to a point where it's affecting various aspects of your life, your work, your day-to-day activities, your mental wellness in terms of the desire to live is no longer present, the desire to interact is no longer present, and people around you take note of this and they feel that you're no longer the person that you were before. At that point, it is very important to seek help. Now, there are various ways in which you can do this. You can go for the options of self-care and increasing activities, as Nancy has very well said. But if someone has engaged in all these and the symptoms are still present, at that point, medication is necessary. At that point, this person needs to see a psychiatrist so that they can get medication. Now, the role of medication, as Nancy had earlier mentioned, is that depression tends to affect the neurotransmitters in the brain which are responsible for our mood. Now, the medication helps to stabilize those moods and even helps such that this person gets out of that whole, the lowness of the moods makes even counseling in itself difficult. So it is actually very advisable if talk therapy alone is not working, if these social changes are not working, medication being added to that equation helps a lot. And this medication helps to stabilize the neurotransmitters. And then this person in time, even with the talk therapy, they will get off the medication. So yes, medication is important and its role is in stabilizing those moods so that even when they're engaging in talk therapy, that works as well.
So people should not feel afraid of starting medication, because I feel, or what I have heard is, people are afraid of starting medication because they might become dependent of this medication to a point where without my mood stabilizers, I can't do this.
Oh, no. That is not the case. Medication is there to help. Medication is there to start the process. And that is why we even advise, even as patients go to psychiatrists, to doctors, to get them on antidepressants. They're advised, in addition to this antidepressant, see a therapist. Because when you're seeing a therapist, when you're seeing a counselor, this person is going to teach you coping skills to help you get through this tough time that you're going through. And these are skills that you're going to learn because at some point you'll get off those meds. Antidepressants are not going to be with you forever. Mood stabilizers are not going to be with you forever. Just for a period of time until you're better able to cope, until you've gone through your therapy sessions and you're at a better stage, not just physically and emotionally, but also socially. Yeah, so you don't get dependent.
All right, thank you very much. Nancy, is there anything you want to add?
Grace has covered it all. I think it's good, yeah.
Mark, I have a question for you. Please answer us. What is your take on illicit drug and substance abuse, and can it cause depression?
I have an example. There's this show, this famous sitcom that used to be called Friends. And one of the actors, Chandler Bing or Matthew Perry, used to suffer from, he used to take alcohol because he said he joined Friends for the money. And then when it reached a point where the money was too much and he realized that the pleasure was too much, he turned to alcohol as a way of like calming himself down. And he also had an accident, I think in around 1998 or 1999, and he was under a prescription for a drug called Vicodin. And after, of course, recovering, he was very addicted. He was so much into the drug that he got addicted to it. And it took ages to get him back to normal, because he said that somewhere between season 3 and season 6, he didn't remember anything that they did. So that goes to show you how these drugs had affected his life mentally, emotionally, physically, because he even suffered from bad health, lost a lot of weight. And you could even see, for we Friends fans, you could see between seasons 3 and 6, he was clearly drenched physically. So I strongly agree that drug and substance abuse causes depression. Yes.
Grace or Nancy, have anything to add?
Yes, but in addition to not just the substance abuse itself taking a toll and causing depression, the changes that occur in this person's life also lead to depression. When one person becomes addicted to a substance, say drugs, say marijuana, say Vicodin or prescription drug abuse, their life around breaks down. And this is one of the main reasons why depression becomes even more common with people who are addicted to substances, because their very being, not just them taking the substance, but also their social support also gets affected by the same, which increases the possibility of getting depression and even makes it worse once it occurs.
Okay.
Yeah.
All right. Yes, Nancy.
Yeah, true, because you have no fallback
Exactly.
when you go into depression. Then I'd like to look at drugs and substance. When you take them, they stimulate or lower your mood. And that is not your body's natural way of functioning. So when you're used to taking drugs that are stimulants, the minute you're not on them, then you go into a depressive mood. Okay? And if you're depressed and you're taking something if you actually have a high mood, because there are people who have, they're very energetic, so they take things like alcohol to calm themselves down. That's not their body's natural way of coping. So when you're not on it, then you can go into a depressive episode. And when maybe you have a job or a school that requires you to stay sober, when you're not on those drugs, the depressive episode starts kicking in, and you can fall into the major depression. Yeah.
Because your so-called coping mechanisms have been taken away from you. All right, that is quite interesting. I believe we have more to share as time goes on. So I have one question that I would like for all of you to answer is how to manage depression and also self-care. Though we've mentioned so much on self-care, but could you just round it up for me and for all of us also who are watching? Mark.
I think one way of dealing with depression is if you feel like you're in a position where you are starting to experience mood swings, at a point where you just don't want to experience pleasure anymore. I think as when the signs are still early, I think it's important you seek help as soon as possible. Maybe by looking for a friend and talking to him, and telling him or her what your problems really are. And yeah, by communicating, I think he or she will be able to help you. Probably not completely, but at least he or she will have known that you have a problem, and when he or she knows you have a problem, I think when he sees you starting to like dwindle, I think he'll try and uplift you. And also, again, you can also try and like if you've had a tough day at work, a tough day in class, maybe try and watch a movie or something to calm you down, because sometimes it's important to calm the pleasure by doing something that you enjoy as a hobby. So I think those are some of the solutions that I have.
Right, thank you very much. Chris, please.
A very important thing that we all need to remember when going through tough times, when feeling low and when going through these tough times, that number one, it's okay not to be okay. Sometimes it's struggle. Things don't always fall into place. We lose jobs, we lose loved ones, we go through tough times, and it's okay not to feel okay. No one has to be 100% at all the times. So that's the most important thing. The second thing that you need to remember during this time is that you're not alone. No person is an island, and even if you're feeling at that stage that even if you try to reach out to people, they're not going to be there for you, there's always one person who you can reach out to. Reach out, even if it's just go like, hi, I'm struggling. Reach out. That counts for something. Another very important thing to remember as a way to manage and even prevent depression is love yourself. No one can pour from an empty cup. You can't be present for your friends. You can't be present at work. You can't be present for your family if your cup is empty. So look for things that fill your cup. Look for things that you enjoy, things that give you pleasure, things that give you fulfillment. I like the way Nancy gave us quite a number of examples of things that we can do. But even the very basic of just turning your phone off and just being silent and enjoying that silence, that counts as filling your cup. So do what you got to do to fill your cup. Don't feel bad about it. And if the worst comes to the worst and you feel like there's absolutely no one that you can reach out to, please reach out to us. We are here. We are going to help. We have a toll-free line. It's open. Reach out to us.
Nancy?
I like to encourage people to have rituals or have a plan for what you do, because that helps you to be centralized. So for someone who is going through depression, go back to how you were brought up as a child. I'm sure almost everybody was taught going to church, praying to God. So when you start your day from that point, even when you're depressed, it's a sort of like meditation, because you're pouring that which you cannot be able to control or anyone else to control to the higher power. And the higher power at this point is God. That is something I always encourage people to do. The second thing you have to do, and it has been said again and again, is keeping contact. We are social beings as humans. You cannot live by yourself. She said you cannot be an island. So maintaining contact. And if you notice someone is not keeping contact, try and do that. Educate yourself, plug yourself into forums where you get knowledge, because when you have knowledge, it's like a tide rising. And if a tide rises, all the boats rise. So when you have knowledge, you'll be able to impact somebody else and someone else, and we are going all to be able to get off the depressive symptoms. Yeah.
Thank you for mentioning that we can communicate to a higher power. I believe in God. I am not forcing anyone to. But let's assume somebody is not born again or they don't confess any faith. Does their support system matter? Any of you can answer.
It matters a big deal. Mm-hmm. And that is why we keep talking of your social support, maintaining contact, mm-hmm. because you get as much as you give. Okay? Mm-hmm. And this is something we all need to be very, very rational about. There are people who are not as friendly, or they have created a wall. So meaning it is very hard for people to know how to address them when they go into a depressive mood. So it is important to build on your social circles such that when you are suffering a low moment, you can be able, or they can be able to come and aid you, because you always are able to do that. But when you're not, when you don't have social support, then you have to wait for a good Samaritan sometimes.
Yeah.
Let me add on to that. It's a good point to acknowledge the fact that, in as much as we would like to assume that everyone came from a family background where guys are always there are people who do not have families that are present. There are people who may feel like they've alienated their friends, or they've not been in contact with their friends for so long that enyewe hawana fallback plan. They don't have a plan B. Yeah. So, but there's always that one person who you can reach out to. The person might be a stranger. Person might be someone who offered to be there for you once in a while. Just having that one person, that counts as social support. Whether it's the pastor of a church you used to go to, whether it's someone who you passed by, had a conversation, and they were like, you know what, if ever you need someone to talk to, I'm here. Reach out to that one person. Because we don't all have faith. We don't all have God as our fallback plan.
Yes.
We don't all have families who are 110% present at ukipiga katikati ya usiku. But you have that one person. That counts as support. And with that one person, you can extend.
All right.
Yeah.
Before you answer, Mark, what if you, Grace, told me if I ever need you, I can reach out to you? Then you just happen not to be present. What happens? You happen not to be available. Yet in front of me is a bottle of something and a handful of pills. Like, if Grace does not does not answer me, it's a wrap. Mark, do you have the...
I'd like someone to actually
Yeah,
explain it,
yeah.
because I also wanted to ask the same question.
Okay.
So I'm also not quite
Okay.
detailed in terms of that from that point of view. So I think I need someone to. Yeah.
Okay.
Okay.
All right.
So when you're going through a difficult situation, it is important for you to realize or admit that that's not the worst that it can get. You know, have hope. Okay. And look at your previous achievements. What are the things that you have ever been able to get out of? What is, think of something that has ever made you smile, or your effort that has ever made somebody smile. That one thought, tweaking your mind from that negative perception to a positive thing, you'll find it builds a ball or a wheel that then can be able to propel you to get out of that thought. And then it's important to know, when you're taking that drug, then what? At the end of the day, you're the one who is going to suffer the repercussion. You're going to fall into a much deeper hole. So it's important to know that you can live your life and encourage others that you had once gotten to a point where you thought of maybe taking a pill or taking substance, and you then tweaked your mind and are able to get out of that. You can be an encouragement to somebody. Yeah, so thinking of how you can be able to support mankind, other than looking at yourself and wondering, why is it, or why is the world so unfair to me? Yeah.
Now, with everything that has been said and done, what is your parting shot for our viewers today? Kindly.
We say in Swahili, usipoziba ufa utajenga ukuta. And with that in mind, I think we've all found ourselves in situations before where we felt like everything is collapsing, financially, academically, physically, emotionally, and even socially. So with that in mind, I am firmly for the idea we all take part in something you love doing when you're not working or studying, a hobby. Maybe if you like painting, paint. If you like acting like I do, take part in a play. If you like drawing, draw. Because I strongly feel that when you take part in such activities, you may not know it, but you may find yourself calming down and even forgetting the stress behind you.
Grace?
It's okay not to be okay. Every once in a while, we need support. Please reach out. You're not alone. And we at Chiramo Mental Health Hospital are here for you.
Mood disorders happen to everybody. And when you are experiencing this, don't be in isolation. Speak out, look for a professional, somebody you can talk to who can be able to address that and not take sides or have an opinion in your issue or what you're going through.
Yeah.
And that's a wrap on today's episode on depression and self-care. Please also remember that we here at PCEA Kikuyu Township Parish are here to help you. We have our youth pastor and the parish minister ready to listen. Their doors are always open, and we are here to give you a shoulder to lean on and a place where you can always call safe. Remember, we also have Chiromo and Hisia ready to listen to you, and they have the toll-free lines which you can call and are open for 24 hours. I have been your host, Sylvia Courier, and see you next time as we tackle PTSD.